What is occupational therapy? If you look online, you'll get all sorts of definitions, some short, some longer, and more detailed. Well, put simply, occupational therapy helps people to do things that are functional and meaningful to them. You may be wondering, isn't that what physical therapists do? Well, while there is some overlap between the two professions, the core and basis of what occupational therapists do is fundamentally different, even though on the surface it may look like those two professions, occupational therapy and physical therapy, do similar things. Let's explore what occupational therapists do a little bit further. If you're new to this channel, my name is Jeff, a board certified and licensed occupational therapist practicing in America. My goal is to increase awareness about the profession of occupational therapy to help people live healthier and happier lives. If this resonates with you, consider subscribing to this channel for more content. Let's get functional. Let's compare and contrast what PTs and OTs do. Physical therapists help people get more physically healthy, hence physical, through exercise, strengthening, balance, and mobility. While similar, the core of occupational therapy is to help people engage in activities that are functional and meaningful to them. When I work with patients in the hospital, I ask them what their goals are in therapy in the beginning, such as during the evaluation, and I often check in with them to make sure that we are achieving those goals, and if we are not, how we can make these goals more attainable to them. And a goal that I often get, a common one when working with patients, is to walk again. However, this is more of a PT goal. And the way that I explain OT to people is that it's doing things when you get from point A to point B after walking there through mobility. This is an oversimplified example, but occupational therapy is what you actually do after you get to point B. You walk to the dining area to eat, walk or use a wheelchair to the bathroom because you have to use the bathroom. You get to the shower to actually do the showering. You get and walk to the closet to pick out an outfit to get dressed or undressed and do some laundry and then wear something cleaner. You walk or mobilize to the kitchen to make something to eat and possibly to socialize, right? You may have heard of the term ADLs, or activities of daily living. The examples I just mentioned are activities of daily living because we often do them, well, every day. OTs work with people across the lifespan, from pediatrics to adults to older adults. Why the term occupational then is kind of confusing because many people think that it has to do with finding a job or to do with one's career. And yes, I understand that that's confusing. We've been grappling with this confusion for a long time, but instead of thinking of occupational like occupation for work, think about occupational as the occupy part, occupying one's time. How would you occupy your time? What do you do in your day-to-day activities to occupy your time? You likely have to spend some time to eat, right? To stay alive, to use the bathroom because you have to. And these are some of the activities of daily living, ADLs. But OTs don't just only work with ADLs because you have to do other things too, right? Like you have to go shopping, grocery shopping, or for items like toiletries, you have to go to school, you have to go to work. You should be doing things for fun, socializing, taking care of yourself, like meditating or other self-care. And these all fall under the realm of occupation or occupational therapy and how we occupy one's time. So once again, occupational therapists like to call these things, these activities that people do to occupy their time, occupations. Makes sense now, right? And yes, because getting back to work and things like that and recovering from, say, a workplace injury are actually things that people may do for recovery, and it occupies one's time and it's very functional and motivational and meaningful to them. they are also considered occupations and things that occupational therapists work with patients to help them get back to daily living. And again, while there may be overlap with physical therapy and occupational therapy and what patients or clients may do, like things like mobility and strengthening, because these also occupy one's time, the core of what we do and the basis for what we do is different. And say, while OTs do this too, we also like to focus on different things. So because of this, OT is also holistic, client-centered, and client goal-oriented. So this means that no two occupational therapy sessions or plans should be the same for two people despite them having the same diagnosis, such as autism or stroke or major depression, for example. And just like how a doctor talks to you to get a history and physical based on your story and what's going on with you and why you may be sick, for example, occupational therapists do something similar during your evaluation to create your occupational profile. So instead of doing what the therapist has planned for you, occupational therapists work with you and their clients to help them do the things that are functional and meaningful to them. And remember how I mentioned that occupational therapy is holistic? This means that OT does not only work with the physical parts of the body, we also work with people on their mental health too, and their spiritual health too. It's all connected and part of what occupational therapists do holistically. So whether occupational therapists are working with families to help, say, a child with autism, a family to help a stroke survivor learn to get dressed, or someone with major depression get back into the swing of things, we also address the mental health parts too. Examples of some strategies that or interventions that may be used include, say, breathing strategies, coping strategies, thinking therapy such as cognitive behavioral therapy, stress management, or even yoga. Pretty cool, huh? So where do occupational therapists work then? I mentioned the hospital part, say where I work. So anywhere from the emergency room to the NICU for pediatrics to the rehabilitation unit. And from there, the hospital patients ideally would go home, but they may also go to places like a skilled nursing facility or a other specialty program in the meantime to get better before they go back home. So OTs work in all those places too, but also outpatient and in people's actual homes if they are not really up to speed after they get home, or if some of these other places are not quite appropriate for them. Say the environment, such as a skilled nursing facility, may not work so well, say because they're not familiar with it and they may have dementia, for example. OTs also work in schools, clinics, and in private practice. OTs work in mental health too, right? So mental health settings include, say, mental health units, say in the hospital, community programs in the community, prisons, and even rehabilitation programs such as depression and anxiety, like outpatient programs for clients. OTs also work in hand therapy, driver rehabilitation training, and with people with disabilities in more specific settings too, such as spinal injury programs. OTs also do consulting work with other industries, such as designing products to help people lead better, more functional lives that are more practical and efficient. So, what supports all of what occupational therapists do? Well, it's similar to other professions. The answer is research and science. Just like how there is research for medicine, for pharmacy, biology, chemistry, even psychology, right? There are occupational therapists and researchers doing research for the field of occupational therapy for the greater public to lead healthier and happier lives through occupational therapy principles and the research backing it. So let me know in the comments, did you know that's what occupational therapists do? Have you had occupational therapy before, or do you know someone who has had occupational therapy? Did you know that occupational therapists also work in mental health? Or are you even interested in becoming an occupational therapy assistant or occupational therapy practitioner? To learn more about occupational therapy, be sure to subscribe to my channel for more OT content. Thanks for watching and have a nice day.